So far on a global basis, we're not seeing it as being a significant change in terms of travel. You mentioned it overnight. We saw changes in Hong Kong, but we also saw a reduction of restrictions and testing requirements going into the UK. So the industry has been in flux. Collinson itself, we've got a medical assistance practice. We've been supporting over 1 million COVID tests around the world, working with over 30 different airlines and travel industry partners, and we'll continue to do that. And as the changes happen, we will make adjustments to support those things. I think the key thing is that the industry will remain in flux for the foreseeable future. We will continue to see both testing and vaccination living in parallel. We've recently done a joint survey with CAPA, over 400 travel industry experts, and 54% of them are talking about how testing will probably remain in effect for the remainder of 2022, and in fact, 26% are saying into 2023. So this is an area that as an industry we're going to have to continue to roll with the punches and adjust as things change.
Todd, I travelled to London just before Christmas, and I've got to say the experience was quite straightforward. Having said that, I had to bring with me a whole sheaf of paperwork for pre-departure tests, vaccine certificates, etc. In terms of the technology, are we there yet in terms of a chip that can be perhaps implanted into a passport that would just expedite and make that experience easier?
Unfortunately, we're not there yet, Sri. We've got a lot of organizations that are working towards that, but the interoperability between various government systems around the world, various industry systems, et cetera, are still not where they need to be. It is an important factor. We see a lot of concern within the industry relative to false vaccination records or false testing records, and so we really want to get to that point of having a properly digitized and interoperable system on a global basis, but we're still a long ways away from that.
So, Tom,